We'll be talking to Mr. Cuthbert Nikubi, and I will explain in a minute who Cuthbert is. And we also have, of course, my co-host Peter Tarlow, and we have Mr. Alain St. Ange joining us from the Seychelles, and the many of you. This will be an interactive session. It's meant for a Q&A. That means after our initial introduction, for everybody, you can ask questions, you can be part of this discussion because we have important issues to discuss. And these issues are Corona, how it is to go through Corona if you get it, what you can do to keep effects minimum. We're talking about masks, and we're talking about anything what is close to you in regards to beating this awful virus. World Tourism Network is a member organization. You can join us if you're not a member yet. You can go to wtn.travel and become one of our supporters. We have currently members in 127 countries around the world, and we're leading the rebuilding.travel discussion. And we work very closely with the African Tourism Board. Actually, our organization emerged out of the Project Hope initiative from the African Tourism Board. And the most important person in the African Tourism Board, of course, is the chairman. And the chairman is Cuthbert Nikubi. Before we go to Cuthbert, I wanted to say also hello to Peter Tarlow, Dr. Peter Tarlow. He's joining us from Texas. He's our co-host. And Peter, why don't you open this, and then we're going to go to Cuthbert, because Cuthbert just is still recovering from a fairly serious version of COVID. We have not really talked to Cuthbert or literally heard from him for the last 2 weeks. This is his first attempt. And Cuthbert, anytime you don't feel well, feel free to leave this meeting, because we're definitely, one thing we don't want to do, add to anything what could make it worse for you. But I really appreciate so much you're part of this, because this is such an important discussion, and I think so many people can learn from you. But before we get to you, Peter, you have the opening.
Thank you, and good afternoon from Texas. Good morning to Hawaii. Good evening to Africa. Good night if you're in the Seychelles or any place else in the world. Yes, I agree with Jürgen. This is a very, very important session. We often talk about means of preventing, but we don't have the opportunity very often to speak to someone who's gone through the illness and come out on the other side. And we're going to be hearing from Mr. Nkubi. He had a really serious case of COVID. He can tell us a little bit about his experiences. And then what we will do is two of us who have gone through the process of being vaccinated are going to talk a little bit about the vaccine side. Then we'll have a chance to talk about ways to not get COVID. And of course, the conversation will then be open to anyone who wants to ask questions, or tell us something about their own experience. So I don't want to take much of Cuthbert's time, because he's the guest of honor today. And I'm going to pass the baton over to him. Tell us a little bit about how you discovered that you had COVID, what it was like, what were some of your fears, and how, I know you're still recovering, so what the recovery process has been like. That's a whole bunch of stuff to have to do.
Wow. Thank you so much, Dr. Peter. I really appreciate your co-host, Jürgen, and my president, Alain, and all the team. It's so good to see you once again. And by God's grace, like as you have indicated, that it hasn't been an easy journey, especially the second variant that is actually sweeping across the continent of Africa. And I know that quite a lot of good men could not make it, that to fall along the wayside. And I believe that by God's grace, our lives are in God's grace. He has really made it possible. I have crossed the troubled waters, and I can safely say now that I'm definitely back into my recovery. because the second variant, I mean, the experience I had, it really eradicates your appetite, and and also it affects your lungs, your breathing, and so forth. And I would like to gladly also indicate that the first day I actually realized that I was positive, I was actually preparing for my journey to Ivory Coast, Cote d'Ivoire, where I had some engagements with the Minister of Tourism and the other business personnel there. Unfortunately, it is a prerequisite that you'll have to go through the process of testing. I went there without any symptoms. I mean, excited, and after my test, that took about a day or so. When I went for my results, I was surprised to realize that I was declared positive, and that on its own, I'm sure it really affected my whole system. That's when I started to have symptoms of flu. That's where I started having symptoms of coughing, and that's where everything just went bizarre. My whole system, which I still have questions which I haven't had answers as yet, especially on the what we are actually using in terms of testing and so forth. How safe would we gladly walk in there with an assurance that when you walk out of that environment, you are not somehow affected by these testing particles. But over and above, I'm really glad that I have made it, and also hasten to say that Cote d'Ivoire, immediately when they realized what I'm going through, we have a team of doctors actually who've been working and developing a medication towards the COVID-19, and immediately they dispatched medication that actually reached me on time, and I started to take the medication, which worked wonders within a very short space of time. And now I can gladly say that I am clear of the variant. I'm clear of the COVID-19. And I then put a challenge to I'm sorry if I'm taking much of your time, Peter.
No, you're the topic.
Yeah, yes, I'm really challenging Africa. I'm really challenging Africa. I was in pain when I was watching the former African Union chair, who is the president of the Republic of South Africa, on the 26th of January, when he pleaded. Maybe I can quickly share with you here. Right. Yes, when he pleaded with the rest of the world, especially within the rich countries. Let me just quote his quote here. I quote, the president accused the richer countries of hoarding vaccines to the exclusion of countries that most needed it. I'm sure in our discussion, Mr. Allen alluded that we have challenges in Africa, we have challenges in South Africa, where even our frontline workers, they haven't actually had an opportunity to be vaccinated. So he said, I quote, rich countries in the world are holding these vaccines, and we are saying, release the excess vaccines that you have ordered and hoarded. There is no need for a country which perhaps has about 40 million people and acquires about 100 million doses or 160 million doses, and yet the world needs access to those vaccines, unquote. So my plea, as well as I was watching him on the television, I said, Africa, it's high time to wake up and smell the coffee. It is high time from the day one when we had the first registration of the COVID-19. We were supposed, or the chair of the African Union was supposed to call upon an urgent meeting with his lieutenants in Africa and develop a vaccine. It doesn't mean that Africa doesn't have scientists. It doesn't mean that Africa doesn't have doctors. We do have most qualified personnel in the world. Why can't we develop our own mechanisms that will talk to us, that will drive our own agenda and move away from the situation where we are on the receiving hand? So that's my plea as well, that African leaders, it's high time to wake up, smell the coffee, and get things done. Let's do our own, vaccines. Let us do our own, medication in Africa, so that we are able to save millions of people who are dying now because of this COVID-19 we are experiencing.
Covered. I think people would really like to hear a little bit about when you got sick. You sick in South Africa or sick in the Ivory Coast? It wasn't clear to me. Where were you when you got sick?
No, I was sick in South Africa.
In South Africa, so you didn't get to the Ivory Coast.
Before I even flew to Ivory Coast.
Okay, so after you discovered that, was it just flu-like symptoms, or tell us a little bit about what it was like to go through the sickness experience on a personal level?
Okay. Look, like I said, that when I went for my testings, I did not have any symptoms.
Right.
I went there so that I can get a clearance certificate that will then enable me to travel out of the country.
Right.
But when I got my results, that's when I started developing flu-like symptoms.
Right.
That's when I started coughing. That's where I actually lost my appetite to the extent that I could not actually eat. I had to force myself so that I keep stronger. That's when I then received medication from Ivory Coast. That is actually—
Oh, they sent the medication from the Ivory Coast.
Yes.
I see. And when you, we heard that you weren't able to speak for a while. Is that true, or?
That's true, Doc. Because every time when you open your mouth, you start coughing uncontrollable. So there was a time where I couldn't actually even— I've actually learned so much sign languages at home because we'd be communicating on sign languages.
Now, Cuthbert, when you went through this time, so you said you developed fever and you took a medication. I found that part quite interesting. Can you tell us more about what you went through and what this medication was you were taking?
Look, it's a variant of organic. Maybe let me hasten to indicate that statistically, when you look at, especially in Africa, especially in South Africa, where I am based, our statistics has indicated that 90% of people who are dying, they are dying in hospitals. And 75% who are surviving this pandemic, they are
You did not go to the hospital.
Quarantined at home, whereby they actually get the organic particles that actually assist their immune systems.
So, Cuthbert,
You did not go to the,
Is that correct?
did not
You
go to the
stayed at home?
hospital. Stayed at home, right?
Did you stay at home?
Oh, yes, yes. I was confined at home.
Right.
That's
And-
good.
And when you just recognize also the gentleman who's just speaking is Dr. Taleb Rifai. And of course, he's one, the mentor for all of our organizations and patron and board member and everything else goes around Taleb Rifai, who was the former Secretary General for the UNWTO. And without him, I don't think any one of us would be sitting here. Welcome, Taleb. Appreciate it. And as far as I know, you're joining us
Thank you,
from
Thomas.
Amman, Jordan this time.
That's right. That's right. I got vaccinated yesterday.
Oh,
good.
congratulations.
Thank you so much, Dr. Taleb. It's good to meet with you after a long break.
Finally, Catherine. Good to see you.
Thank you.
Praise
Thank
God.
you so
Praise God.
much.
I thank God that you're still up and running and you're stronger than you were before. What you said was absolutely
yes.
correct.
Yeah,
Africa must
really
wake up to the call.
And,
Yes,
and
I
I,
really
You're
appreciate
right.
everybody's prayers as well.
yes, and
We were all with you.
And I think what is an important, I wanted to get an important message out of it, hopefully at the end of the call, after we can also open up for questions. And this is the need for people to stay disciplined and focused, I hope. I hope this will be the outcome. It's about mask wearing and all these things we're getting into. Before we get to our second guest, Alain St. Ange in the Seychelles, I wanted to recognize and maybe give the microphone first to Zine Nukwana, and I probably pronounce, I know you very well, but your last name is very difficult for a German to pronounce. And Zine is in charge of communication and is also a board member of the African Tourism Board. And she had her own experience with the virus, what is quite terrifying. And I don't know what you, if you want to share anything, but I'm glad you're here. And why don't you say a few words, Zine?
Good evening. Thank you so much, Yeken. My apologies. I cannot be on video at the moment. Hi, Chairperson. It's good to see you, and welcome back. Though you and I stay, just a kilometer or so apart, but I haven't seen you in such a long time. I'm happy that you are here. My apologies. I cannot be on video. I'm not feeling very well at the moment. No, Dr. Taleb, I did not particularly get infected, but I think I'm one of those people, those millions of people here in the world who have been affected by the effects of COVID. I suppose what Jürgen wants me to share really is the fact that I have lost so many members of the family as well as friends, of course, due to succumbing to COVID. This is one of the reasons why I cannot be on video, because it's a very emotional topic for me. I am counting now to date, roughly about 25 to 26 people that I have known, grown up with, others family members, friends, and colleagues who have succumbed to death, to COVID. So therefore, those are the people that we have buried. And I think one of the things that are very, very sad about this is the inability to attend the funerals of your loved one, because you are not supposed to go there. You watch, and this is it's a taboo. It's actually very, very tough, particularly for us as Africans. More so in my culture, you need to be there for each other when something like this happens. So for us to be watching funerals on YouTube, on Zoom, or whatever platform that gets to be used is something that is just not on at all. You don't get the closure. Just a week or so ago, I remember I told all of you, here again, Dr. Taleb, Alain, Dr. Peter, and all of you, I told you about my cousin brother that I've lost.
That's
and
right.
I could not breathe at all, because we had just buried his other brother. And before that, we had just buried my aunt. So it's something that is just, you don't get a chance at all to grieve. You don't get a chance at all to even understand what is happening around you at all. It's death upon death upon death. And you literally, your head is spinning and you don't know how to deal with all these emotions because you're alone it's either in your house or those people who stay alone. Luckily, I have a family, husband and 2 daughters. But those who stay alone, you can imagine, because you're just all by yourself and have to watch the funerals of the loved one. So what I would say to people, this is not a joke. If you have not suffered a loss through what COVID has done, the devastation that this causes, I'm not sure if we're ever going to recover from it. I suppose one would have to go for counseling because it just doesn't make sense that there's somebody who's dying almost on a daily basis. You feel like
Zina.
screaming.
Yeah.
Yes.
Zina, have you tested yourself?
Yes, I have tested quite a number of
And
times.
it's negative. And it's negative.
Always come out negative. I
That's
suppose
good.
because
That's good.
I don't go to the funerals. I don't mix with the people. I think the last funeral that I attended was with my other cousin brother, the one that, if you recall, Yeken and Cuthbert, I think it was around October. So that's the last funeral that I went to, and he did not die of COVID, that one. But again, still, we only had to be 50 people in the family. But now everybody else has been passing away. For now, I have not gone to any, to any funeral, to any gathering, and that's the other thing, because you just feel isolated in your house or in your place. So this thing is not a joke. People should really do exercise social distancing. People should really put their masks on. People should just stay away from going to any of the gatherings. I have not been to church. I'm a Christian. I have not been to church for over a year or so. And you miss those things. So therefore, you just feel all by yourself with all this death. I'm writing down the names of everyone who's passing away that I have not been able to bury. That's why I know the number is about 26 now at the moment. And it's something that I've never experienced in my life. And all this happened in just 1 year. 1 year.
And I remember what it's like. Last April, my mother died. And I had to do a funeral on Zoom, and she died in New Jersey, and I still have not been able to get to New Jersey in order to visit her grave. So I think you and I spoke a lot about how Black and Jewish culture are so similar.
Yeah.
And what we have in common, and how in both cultures, the fact that you're used to having large funerals and people coming together and hugging and being with each other. And now we are living Zoomatic lives.
It's something, I'm not sure how to recover from this one, Doc, at all, really, truly speaking. I know quite a number of people whom I've been working with. I've kind of become very aloof and very distant, and I'm not doing it on purpose. This is the thing people need to understand. You don't do it on purpose when you just want to keep quiet and just be alone. You're not doing it on purpose. You just sit there all by your lonesome self, and you can't. Every time the phone rings, I actually have written something, because I also write all my thoughts in my journal. I've become to hate my phone because it brings bad news. When messages come through my phone, be it WhatsApp or any of the messages, I literally just want to hide away from the phone. But at the same time, that's the only means of communication to get to know that a friend, a relative, a family member. Again, and for us as Black people, the term relatives is not. We don't really have extended family as such. So everyone that you are related to becomes a family, because we used to growing up in large families. This whole thing of having the nuclear family and having you and your husband and your kids alone, this is a taboo. This is something that's new, that has been brought by the transformation and whatever the civilization, whatever that you may call. But we grew up in large families in the townships, in the rural areas. And the people who have passed away, those are the people that I know, that I grew up, that I consider as family. And I lost my mother at a very young age, followed by my father, followed by my brother. So I know what it means to lose very close family members. And it takes a while for you to get over that. Actually, you never get over it. You just, with the time, the pain gets better. You learn to deal with it. And when I lost all these other people, that is my parents and my brother, at least it was years apart and I could deal with the grief. But now it was a person upon person upon person. I'm still rewinding, going back to April when all the deaths started happening to now, about 26 or so people. It really, really, really hurts. And I would like people to understand that the devastation that you feel because of this pandemic is something that we'll never recover from. So I thought I could just share that. And again, my apologies that I refuse to be on video because I get emotional. I am emotional as I'm speaking, and I'm trying for you guys
But
not
you're
to
doing
remember
very
me
well. So
with a face that's crying. I think my photo, they see me smiling, they at least remember me like that, not the way that I feel right now. And again, when it comes to economically, the things that we are suffering because of the lockdown, no businesses, no income. Even if you were to want to go to these funerals, would not even be able to afford to go there. So it's a number of things that this pandemic has done. Here in South Africa, we are really seeing a lot of we even have got the strain that these people say that it originates from South Africa. But what we have picked up is that people are getting infected much faster than the original strain. On a daily basis, you hear news of somebody who has passed away. So I'd like to leave everybody with that and say, please be careful, always wear your masks, minimize going out. If you have to go out, it has really to be necessary to just go and buy the essentials, because when you die, your family, and I know I'm talking as part of a family member that has been caught up in this, the pain, too much to bear. Thank you so much.
And Zina, thank you so much
Thank you, Zina,
for being so brave to come forward, because I know
Yes.
it must have not been easy to share this with the public. And you're an amazing woman. I think so many of us can learn from you. And this virus, again, everyone sees is so much bigger than economy and the travel business and whatever business we're in. It's affecting lives. It's a life and death decision, and sometimes these decisions are not easy. But there is a light at the end of the tunnel now, and I know three of you, at least, maybe more, already experienced the first step to beating this virus with a vaccine. And I wanted to go to Alain Sandan. Alain, of course, for those that don't know Alain, and I think everyone does because he's very public, but Alain was the former Minister of Tourism for the Seychelles. He's the president of the African Tourism Board, and he has been very outspoken, traveled around the world, known everywhere. And Alain, it's late for you. I know it must be like 10:30 in Seychelles, and the ocean waves are telling you to go to sleep. So thank you for joining us.
Thank you very much, Jorgen. I think before starting, I want to wish Cuthbert well. We are happy that you've survived it, and you are one man from Africa that shows that we can beat the virus when we put our minds to it. I see a lot of messages coming in, Cuthbert. Which medication did you take? And it'll be good for you to tell our audience a bit later what you got from Cote d'Ivoire for you to be able to get better in one go. But when Cuthbert was making his presentation, he said, Africa, wake up and smell the coffee. He made me smile. Smile because today I think what we have to do is to tell the community of nations, Africa, and everybody in the community of nations, wake up, yes, but get the little feeling of the injection, the vaccine. We must be taking the vaccine. I know I reacted badly. I reacted very badly when I took it some 2 weeks, 3 weeks ago, the first dose of it, and I'll get the second dose on the 2nd of March. I reacted badly, had fever, could not eat. but some people react worse than others. I've got friends that had no reaction whatsoever from the same vaccine. I could not take the Chinese one that was the first one being distributed in Seychelles, but I got the AstraZeneca, the Oxford one that we got from India. And that dose is for people that has reached a mature age. And for people that had reached that age, we had to take something that was convenient for the most aging population. But having said that, I took it. Today, Seychelles, probably of the continent of Africa, is one lucky country, one lucky state of Africa. We have, to reach the herd immunity, we need to get to 70%, 70,000 people of our population. So we have today in the island already vaccination is taking place, where we've got 25,000 of the Sinopharm from China and 25,000 of the AstraZeneca coming out of India, the Oxford one, which puts us at 50,000 people that will be vaccinated out of the 70,000 that we need to get herd immunity. We are on the right track to put COVID behind us, but we still need, even in Seychelles, that most people now have had their first dose, we still need to get the second dose. It is very important, otherwise it dilutes the effectiveness of having taken the first dose. But my appeal, I mean, now that I have a vaccine, I succumbed to it initially, but I popped up very well just after getting ready for the second dose, is for everybody who can get the vaccine, take the vaccine. But let us be also prepared until we get the vaccine. And between the first and the second dose of the vaccine, we need to ensure that we wear the mask, we practice social distancing. I think what Zina said earlier, we have to change the norm of our living habits. We can't go to church, yes. We can't go to funerals, we all suffer with this. But we need to save our lives, the lives of our family, the lives of our community. So it is important, very important, that what the health practitioners are telling us, the public officers of the Ministry of Health, when they say social distancing, we must all observe it. When they say wear a mask, we must all do it. It is so important for Africa, for me, for Seychelles. It is so important for the community of nations from right across the world to say that we need to change habits and to be prepared, to be conscious that our effort, the single effort of a person, will help save members of his own family and members of the community. Let us work together. Today, the news coming out of Europe was saying how health practitioners, nurses especially, in some countries of Africa, were not getting adequate vaccines themselves. As we appeal to the world that the vaccines, we mustn't hoard a vaccine. We'll have it, it'll go stale very fast after that. Let us make sure if we are going to open travel, because we are all in the travel industry, we need vaccination to be applicable. Seychelles will open its doors very soon as herd immunity has arrived to the islands. But we need the world also to be vaccinated, because kids, school kids are still not vaccinated because we don't have a vaccine for them. We need to ensure that vaccination is practiced around the world. Today, we are rated probably as an island, as a group of islands, as number 3 after Israel, and I forget who is the second one. There are 3, maybe London, England itself, 3 countries have been spearheading the vaccination at full speed ahead. Seychelles, I'm proud that we are part of this. But the world needs to be vaccinated if we are going to put COVID behind us. I wish you continued health, Kabir. Zina, I feel for you. And I know a lot of us feel what you are all feeling, because we have somebody in the family somewhere who's fallen sick or passed away. But it is holding hands together as a community of nations that we will be able to get through COVID, put it behind us, and reopen tourism that is so needed to put money in the pockets of our fellow citizens. Thank you very much, and let's have a good discussion tonight.
Yeah. Thank you, Alain. And before we go to Peter and maybe also Taleb to hear about their experience with the vaccine, one quick question. We had a very controversial story last night, what involved the Seychelles and involved Israel and the United Arab Emirates. A tour operator in Germany announced that they're working on vaccine tours, and it included these three countries, including the Seychelles, to accept visitors to come to their countries, stay in luxury hotels, have a great vacation, and also get the vaccine. And of course, we all need to get the vaccine eventually. And countries, as you said, that are able to develop herd immunity, that's what we're all striving to. And Seychelles is on the best way as maybe one of the very first countries to do that. Of course, it's a business model because immediately it would get your hotels full on rack rates and maybe even more. Tourism is coming back. And it was said these activities are not taking the vaccine away from the local population. So it may be something good. So I'm just wondering, you heard probably the same story. Maybe you don't know enough about it, but I'm just wondering if you had any feedback on this.
But I think, Jorgen, yes, I read the story. But the public health announcements and the regulations for Seychelles to open up towards March, as soon as herd immunity has been reached, that is 70% of the adult population, we are hoping, Seychelles is hoping, to open its borders. Open it, but for everybody who's had a vaccine before and who's been tested negative. Once you've done that in your own country, and this is where my appeal, and probably somebody like you, or Cuthbert, or even Taleb, we have now to push to have a little passport, a COVID passport, a bit like we have for yellow fever, to say that I've been vaccinated, and it is an official one, that we don't start finding so many bits of papers flying around. But visitors to Seychelles will require the vaccine to have been taken, the first and second dose, because it is useless having just one dose and coming here, and having a test done before coming to Seychelles. After that, there's no quarantine, there's nothing after this. You go into your hotel and you enjoy yourself. But vaccination will be an important ingredient for you to travel to Seychelles.
Yeah, no, and of course, this is a very interesting move, and I think this might be, Seychelles might be setting a trend for other destinations to stay safe. But the vaccine, getting the vaccine in a destination is something different. We may just have to follow the news and see how this goes, where this goes, if it's done, how it can be done ethical, because that is important, and how it could actually benefit the world, possibly benefit tourism, and to make it a win-win for everyone. But let's go to Taleb, and thank you, Taleb, for joining us. I know you just returned from Spain to Jordan to get the vaccine.
That's right. Thank you so much, Jorgen. First of all, I want to congratulate Cuthbert for being with us. Cuthbert, it's good to hear your voice again. I was hesitating to call you because I knew you were not speaking well. But it's good to see you. Good to see you're giving all these good advices. And Zine, you know how much I respect you. Zine, I think what you're suffering from is very understandable to all of us. Thank you so much for being with us and sharing your very personal and intimate stories. Now, I want to differ with Alan a little bit. I won't put so much hope on vaccination. I've been one of the lucky ones to get vaccinated here in Jordan. The day after I arrived back 3 days ago. 2 days ago, I got the vaccine. I'm feeling okay so far, but I still need to wait for 3 weeks. The 3rd of March is my second vaccine, as yours, Alan. But the point is this: the world will not be able to travel unless the whole world is vaccinated. In other words, it's not enough to have one country or two countries do that on their own. That's the problem with the international system nowadays. What Jorgen was referring to is ethics, how ethical it is to have some countries being able to vaccinate some people, some other countries not being able to do that. That's not right. That's not fair. I mean, we need to be equal in this. It's humanity that's at stake. And travel and tourism is the essence of humanity because it connects people together. You can't go from one country, one destination that's not vaccinated, another destination that's vaccinated, like Seychelles. You can't do that. So only the select people would go. That's not ethical. I'm not sure about the vaccination now. I put more my bet on the testing part. I think testing must become more accurate, more affordable, more reachable, more easy to get. And the world must come into harmony in this. For example, many countries now are adopting a system of 72 hours before you travel, you must be vaccinated. Then you could test it. Then you could test again. When I came from Spain to Jordan, I tested before leaving 72 hours, and I tested again at the airport in Amman, Jordan. And I'm negative in both. I'm a very lucky person. At 72, I'm very lucky to be like that. But the point is, testing is very, very important. We have not yet bypassed the hurdle of testing before we go into vaccination. People are not vaccinating now because either they can't get their hands on a vaccine or that they don't believe in the vaccine. Unless that hurdle is passed, Alan, can't put all our hopes on the vaccine. You know what I'm talking about. That's what I wanted to say now. Thank you so much, Jürgen. I'd be interested in hearing everybody else's remarks on this one.
Yeah.
Thank you.
Thank you very much. And now finally, let's go to Peter. He also got the vaccine, and he will tell you his story.
Yeah, I'm a little bit different from both Alan and from Talib, that I've already had the second vaccine. So when you get the second vaccine, you get a card like this that indicates that you have been fully vaccinated. So that's the good news. I'm very lucky. I live in the state of Texas, and Texas has done an extremely wonderful job at getting vaccines to really almost everybody. They're doing a really good job. Now, I really think there's three levels that we have to think through. Testing is good. The problem with testing is that you can be tested in 48 hours. After you're tested, within those 72 hours, you can get sick again. So it's a help, but it's only a help. I think one of the areas we haven't spoken about is that the need for therapeutics, because no matter how much you test, people are going to get sick. And if you have therapeutics, and I think that's what saved our friend Cuthbert, whatever those therapeutics are, that gives hope that it goes from a disease that kills to a disease that is manageable. And then, of course, the third part of that is to have vaccination. So you want to have
Peter, you mean treatment?
So
you mean treatment?
Yes. So one is testing. Two is therapeutics, means treatment. In other words, that I can give you some sort of medication should you get sick. And thirdly, of course, is you want to prevent people from getting sick. So those are really three parts that need to work together as a plan to help eliminate it. Now, in my case, I was very lucky. Most people do not have a lot of trouble with the first vaccination. It's a second vaccination that's a little bit rougher. And you can think of that as somebody punched you in the stomach, but your stomach is still pretty strong. But you're now kind of recovering from being punched, and now you get the second punch. But
which vaccine did you take? Which vaccine did you take?
I had Moderna.
Moderna.
Yes. In the United States, as in Europe, they're using most are using either Pfizer or Moderna.
Or Moderna, yeah.
Yeah. Moderna is a little bit less unstable. Pfizer needs to be kept at 17 degrees below 0 Celsius. Moderna is an easier vaccine, especially in places where you don't have the refrigeration necessary to keep it. So I had the Moderna, both Moderna and Pfizer on the second shot. Now notice, please, I've said the second shot, not the first, give you about 95% protection, which is incredibly wonderful in comparison, say, to a flu vaccine, which is between average is 40%, but it could be as low as 30% or as high as 50%. So it's a much more effective vaccine than the flu vaccine, which is, and flu is also corona. So they're both, within the same family. So these are really good vaccines. Whatever vaccine you get is better than no vaccine. I believe AstraZeneca is about 70%, though now there's a second booster for AstraZeneca, which will then get it up to the 90%. But again, 50% is better than zero. The second one may hurt more, but then it's a crapshoot on some level. Some people, I had an arm that hurt, but nothing more. Some people feel they have very bad flu-like symptoms, as Alain described, especially on the second shot. And some people have nothing at all. And what's ironic about this is it has nothing to do with your body size or your age. I know people who are very small women who are in their 90s had no problems at all with the vaccine, and big, strong men, but they were in their 60s, but, people maybe who are quite tall and quite muscular, they were just knocked to the bed because of the vaccine. So so there's no real way of, it's your genetic makeup, nothing more than that. Having said that, I really want to emphasize what Alain said, and that is get vaccinated. If you can do it, do it. And we need to get as many vaccines out to as many places as possible. And that means one of the things we need to do is to develop, is to license other countries to produce these vaccines. So for example, Talib, also that the Teva Corporation in Israel is now going to start producing vaccines, which will be used for the whole Middle East. And so again, that will produce over 40 million new vaccinations for people across the Middle East. That's a really important area. The same way that can be done in Africa, can be done in Asia, can be done in Latin America. We haven't discussed Latin America at all, but Latin America is really suffering. You have well over 1 million people in Mexico City who are right now infected. Brazil is running out of oxygen because they don't have, I don't mean the oxygen in the air, but the oxygen they give you if, God forbid, you go to the hospital. So that you have real problems across the world. And in order to solve those world problems, we have to work as a world community. And that means licensing, not seeing this as a money-making institution, but rather as a institution for the goodness of the world. And we're all on one ship, we're all on Noah's Ark. So we need to work hard together to make sure that people go. So again, 3 stages. 1, yes, I get tested. 2, we need very strongly to work on new ways to come up with therapeutics, with medications. And lastly, the armament around our bodies, which is the vaccine, give that to as many people as possible in as many places as possible in order to create world herd immunity. I didn't suffer much. Other people I know have suffered, but the real issue is get vaccinated. I cannot emphasize that enough, because that will help to prevent the suffering that Zinde's gone through or Cuthbert's gone through, and we can come out on the other side.
Thank you, Peter. And I see there are a lot of questions, but what I think we wanted to do is I wanted to give Cuthbert the microphone a little bit to weigh in on everything we discussed. And after this, I have some specific people they may not know. I wanted to ask something, and this goes more into the type of mask and other things. But Cuthbert, the microphone is yours.
Thank you so much, Jürgen, and thank you so much to the leadership of African Tourism Board. I still want to emphasize that the ground is not level. And I have actually noted that Africa has been put on the backdrop of any event that is going on. And it's unfortunate, as Dr. Taleb has indicated, that when you talk of COVID-19 and it's all about connectivity, you cannot shift the blame to another continent. It will come back and haunt you in the near future. And that's why my emphasis is for Africa to wake up, and this dependence syndrome we have so much inherited. It is reflective. It's a reflective now. That is why in Africa, South Africa in particular, Dr. Peter, you had, talking about the AstraZeneca, that you have, I am not sure the quality of that vaccine is the same quality with what is being dumped in Africa. We are sitting here with massive stock that have been paid for by the government, but unfortunately only realizing that the expiry part of it, it's almost there. And the expiration date is another headache, especially to Africa, as the very same vaccine rollout was put on hold by the government because of the findings that the Zeneca vaccine was not effective against mild and moderate COVID-19 infections from B1351 variant. So my plea is Africa must wake up, develop your own mechanisms on protecting your own citizens. When it is found that the vaccine only offers about 22% protection from infections caused by the virus, and it's so sad. And I was actually observing and making a follow-up on the WHO. They are endorsing and saying, no, Africa, take this vaccine, it is safe for you to take it. So I'm still very much worried, colleagues, that as the tourism sector, I think we need to play our role in saying, colleagues, if we are saying we are now a global community, what do we mean by that? Do we mean by excluding other continents? But in essence, if we are truthful to ourselves that we are a global community, we need to walk the talk. Let's come together. Let's make sure that anything that affects Africa, it will affect the Caribbean. Anything that affects Australia, it will affect Africa. We are in a predicament where we would really appreciate if there is sympathy, especially within the global community. Please, let's walk the talk. But to our African leaders, my plea, please wake up. Wake up. A lot of people who are not supposed to be dying. They are dying because of our negligence, because of our interest within the conglomerate pharmaceutical companies that are benefiting from all these activities. So it is high time for us, please, let's regroup together and talk with one voice and make sure that we implement some of these discussions we are doing again.
And Cuthbert, I think your points are so well taken and so important. And you really speak the voice of Africa here, I think. I'm not African, but I've worked with you on African Tourism Board, and I think you have so many good arguments, I think, that needs to be applied maybe not only to Africa, but also to many other regions in the world. And I wanted to get to a subject we had covered also on eTurbo News extensively, and there is a lot of different opinions about this. Here in the United States, to come back home here, the CDC is recommending for people to wear masks like everyone else in the world. That's a good thing. Okay, so finally, we also have an administration that not only wants masks, they want double masking. So we're now supposed to double up on masks. That's also a good thing. But I think we're overlooking something. What I'm very appalled of, and this goes more to a US issue, is that in the United States, it is completely okay to wear cloth masks. And I know in many regions in the world, this is also okay. And there's an exception, and I'm very proud of this exception as a German or German American, and that's why I wanted to give it to Wolfgang Hoffmann in Düsseldorf. And he may not be an expert, but he's in Germany, so he can fill us in. Germany, I think, was one of the first countries requiring FFP2 masks. These are masks similar to what we know in the United States under N95, in Korea under N94, or in China under KN95 masks. What these masks are doing, they're not only protecting others, like surgical masks, or to a lower extent cloth masks, they're also protecting yourself. And I'm very angry, I have to say, and I'm very appalled that our health department in the US is not seeing this and actually say, oh, we don't need the N95 mask. And they only say this because they say there is not enough protection, but there is protection on the Chinese side. It all becomes political. So I'm just wanted to hear from Wolfgang, if you maybe have any background. You live in Germany and you just extended your lockdown till March 4th or March 7th. And there is a requirement on certain masks. Am I correct on this, Wolfgang?
Yes, Jürgen, good evening to everyone. It's at the beginning, everything was allowed, scarves, everything. The only thing, you had to tie it to your head. You could not hold it, a piece of cloth in front of your nose. And since about, I think, 6 weeks, they asked for a medical mask. The medical mask, I just went out to get some, is either this, that's what we call the mask doctors are wearing for operations as well. Or the FFP2 is this one.
And Wolfgang, maybe if I interrupt you there, there is a big difference. And I wanted to clarify this because we also reported about it. The medical mask, we call it surgical mask. It's really only protecting the other party. It's not protecting yourself. The only mask that is protecting yourself is what you call in Germany the FFP2, what we call the N95 mask. And it's a big difference between the two.
Yes, it's a difference, but there are new discussions now that if you really want to protect yourself, you have to wear the FFP3 mask. And the FFP2, it is thicker than the other one, but the virus is so small, nanomillimeters, that it passes the FFP2 as well. It protects you more from the aerosols, from the humidity when you speak. But if the virus is touching the mask, it passes FFP2 as well. It's more protection than the surgical mask, but not real protection. If you want to have more protection, you would have to wear FFP3. What I do now, I wear, and some airlines, funny enough, Lufthansa, for instance, said you can wear the surgical mask. No use to wear the FFP2 mask because we have such a good ventilation system in the airplane. KLM said you have to wear FFP3, FFP2 mask, and 3 of them on a long distance flight. So every 3 hours you have to change and get a new FFP2 mask. So nothing is really, really very safe. And one thing is it's more difficult to breathe with the FFP2 mask. Last year I did some flights to Rome, to Croatia. These are 2-3 hours flights. Easily within a surgical mask. I would not do a long distance flight with a FFP2 mask because it's much more difficult to breathe with a FFP2 mask. So there's a lot of different opinions on this, but it's for sure that the FFP2 mask does not really protect you against the virus. It protects the other one, right? The surgical mask protects
the surgical mask, not the FFP2. The FFP2 protects better.
Wolfgang is right. if you can smell something, then you're not getting full protection. So what he's calling the FFP2 is not fully protecting you. It's not much different than a surgical mask. It's been sold that way, but it's not true.
Okay.
The FFP3 might do a better job, but an easy way to figure this out is if you go to a supermarket and you can smell the fruits and vegetables, if it can get through, then the virus can get through.
And that's a very good point. I mean, I think what we really learn out of this, that a mask is not a mask. And we have to, as much as we have to educate ourselves what the best vaccine is, the best medication, we need to educate ourselves what is the best mask. Otherwise, we might have all the best intention to protect ourselves and protect others, and we're not doing a good job and don't even know about it and put others in harm's way. And Wolfgang, thank you very much for this clarification. And I think it's equally important to up the production of effective masks in the world as it is to up the production on vaccine. And of course, if there is a medication, specifically natural medication Cuthbert was talking about, that is also another very, very important point.
Jürgen, can I say something before
Sure.
I will leave you shortly. But today, nobody is sure the vaccinations that we all are taking, that we are running to take, it'll take months for the world, or even years in some area, because I saw today Mozambique said not before 5 years can they vaccinate everybody. So the duration of the cover that we get from the vaccine, this is something that is being discussed, but no one really knows for sure. They say some vaccines have a lifespan of giving you protection for 6 months. Others say that some other vaccines have a year. So it is very much a flu shot that you'll have to take again. Can we get some clarity on these vaccines? How often we will need the booster? How often we will have to take it? If today there's a scramble in the world to get a vaccine, if you need it again in a year, there'll be a new scramble in a year to try and vaccinate the world. We need clarity, and I think you are one of the best persons to try and push forward so that we all know where we stand.
And of course,
Alain, you're absolutely right. Nobody knows at the current moment what's taking place. The country that has the best data is Israel, as you know, because they have kept incredibly careful data on millions of people. The good news is, at least on the Pfizer vaccine, that of the people who have had both shots, not one shot, both shots, the chances of you getting COVID is 0.004. In other words, you're almost totally protected. And that's even for people for older. Now, one of the things that you want to think about is that as we get older—
For how long? For how long?
Right. Well, we don't know that yet. That's a very good question. Some people believe, the common belief, it'll be at least a year until you need a booster shot. But the other part of that is, if you're talking about a 40-year-old, that person's immune system is double the strength of a person who's 70. So, but it does appear, and again, these are only appearances, and so any piece of data said today could be wrong tomorrow. It does appear these vaccines are working on immune systems also for older people. And if that's true, that's a real breakthrough. We're not sure yet, but the data appear to be going in that direction. So it looks like most likely it'll be a yearly booster, something like when you get a flu shot, which would make sense because COVID is a coronavirus, as is influenza. So they're in the same family. So you probably need a booster once a year. But if we can produce millions and millions of doses, then that would be able to do it. The only way to be able to do that is to license the production of vaccines in countries around the world, so that you're not importing, but you're actually producing local vaccines. But
and that's definitely
something the world has to work on.
Yeah, and Peter, that's such an important part. And I think specifically for Africa, I assume Cuthbert would probably agree with you on this. Cuthbert also put on the chat, and I wanted to read this for everyone. And this is not like we're endorsing or not endorsing it, but it did help him. And I think we should see how we can do some more research on this. And I will actually share this with Professor Snow White in Serbia, who raised her hand, maybe to help with this type of research. But it's the BJ12 developed by a team of researchers by Dr. Diamana from Ivory Coast. So that's what helped Cuthbert. And that's good information. So we're going to stay on this. Now, before we go to Professor Snow White, who is also running our educational group, and she's in Serbia, I wanted to give, and it's maybe just a surprise, to also recognize Alexandra in not too far away from Serbia. She's in Montenegro, and she's running our global chapter for the Balkans. Alexandra, how's the situation there? Any feedback on what we discussed so far? Welcome, first of all.
Yes, thank you very much. Greetings to everybody. I'm glad that you are all well, and hopefully it will get better soon. Regarding the situation here, well, I'm kind of disappointed, or I could even say angry, because it looks like that Montenegro is the most infected country in Europe, which is unacceptable for me, because we do have measures in place, but nobody's following it. There are no restrictions, there are no penalties for not following the measures. So everything is everybody is so confused, and I think the confusion is made by government, because they are the one who didn't put things in the right order. So we don't have vaccines. We haven't even. We just ordered vaccines like maybe a week ago. We haven't done it till now. We don't have any protection measures or anything. So it's just complete madness here in Montenegro, I would say. And of course, on the other side, it's winter season in Montenegro, and first time for last, I think, 3-4 years, we are having snow now. And ski centers, actually 1 or 2 ski centers that we have, they are packed with the domestic and regional tourists, but nobody's following any measures, protecting measures, and that's why corona numbers are increasing rapidly. So that's how it is, unfortunately, in Montenegro at the moment.
Thank you, Alexandra, and let's stay on this as well and see what we can contribute to make the government of Montenegro maybe more aware, to get in step with many other countries in the rest of the world. And Professor Snow White, I know this is not your true name, it's a translation of your name, but it makes it so much easier. And I wanted to just recognize the professor, because she has been a guest almost on every single show, I will call it show now, on every single event. It's really not meant to be a show. But Professor Snow White has been outstanding in following up on anything, and we discussed. And she's also running our new educational chapter, and we're going to have an event with the educational interest group better very soon. Welcome and hello to Serbia.
Good evening to everyone. I'm listening this about the vaccine, and I agree that we have to be together on a global level, because it is very, very important. I'm very sorry, because the situation in Montenegro is like it is. Although Serbia wanted to give something like, I think, 8,000 vaccines as a first aid, Montenegro didn't agree to take our help. In Serbia, we started vaccination with a small amount of vaccine at the very end of December. And then we realized that we paid about 3 or 4 million vaccines, but we are not getting them because something was happened with Pfizer and I don't know what. They gave us only, let's say, 1% of a vaccine and such things. And then in January in January, situation was very good because we brought about 1 million vaccines from Sinopharm, 500,000 vaccines from Sputnik 5 from Russia, and we got some Pfizer's vaccines, 10,000, 20,000, like that. We got also last week or this week, I don't know, something like new 50,000 Sinopharm vaccines and 200,000 Sputnik vaccines. So now we have a two group of people in Serbia. One group is going for revaccination, another group is going for the first vaccination. The politic was that the oldest citizens of Serbia are going to get first, they have a priority, plus 65 plus people in Serbia, they have priorities, and a lot of them are vaccinated. So we are, as I can say, very good in vaccination. According to our reports, I think that until the end of February, we will have nearly 1 million people vaccinated, and we are second after Great Britain, best in vaccination of the citizens. Why it is like that in Serbia? First of all, because we didn't wait for Pfizer vaccine only. Our politicians, they are trying to get vaccines everywhere. And we got, now when I wanted to be vaccinated, I went to internet, I filled this report, and they asked me, do I want a Pfizer vaccine, Sputnik V or Sinopharm? And AstraZeneca will come, they say, in about 2 weeks. So in Serbia, now we can choose between 3 different vaccines, but we can say what we want, but before we are vaccinated, at the place where the vaccination is going on, there are doctors. First of all, you have to fill a paper about all your diseases, if you have them or not. Then you have a conversation with the doctors, and then doctors say which type of a vaccine you can take, and then you choose. And I think that it is really, really very good. Also, we had very bad lockdown at the beginning in March and April last year. For example, people over 65, they were about 45 days. They are in quarantine 24 hours. Once a week, they could go early in the morning. Shops are open only for the people who are 65 plus to go to buy their medicines, to buy all they need, food, beverage, and such things. And although some people were angry, it was really very good because we didn't have many mortality during all this from March up to now. And I think that it is really very good politics how to deal with this pandemic, with this epidemic. Don't forget that in ex-Yugoslavia, we had a very big epidemic shock in 1972 with smallpox, and it was a very big problem at that time. In 2 weeks, 18 million Yugoslavs were vaccinated in 15 days. So here in this area, in ex-Yugoslavian republics, we have really, how can I say, very good institutions who can do that. But the organization is the most important. So I just wanted to say that I'm waiting for the vaccination, and I'm I think that I will choose Sputnik V or Sinopharm because because the Pfizer vaccine, we don't get much of them, but the Sputnik, Pfizer, and Sinopharm are very good for people over 65. Although at the first time, they said that the Russian vaccine, Sputnik 5, was up to 60 years old, but the new, how can I say, examinations say that they are also good for people over 65. So I will tell you what, and of course, the problem is there any bad situation after you get the vaccine? Here in Serbia, we didn't have a very bad situation. There's something like, for example, in Belgrade, about 150,000 people were vaccinated. There are 60 people who are having temperature or red dots on the spot where they were vaccinated, but it was, I mean, they have that only 24 or 48 hours and nothing after that. So revaccination is getting on, and then we will see how it is going to be with the people after the revaccination. That is in
by Sinopharm, you mean the Chinese vaccine?
Sinopharm is a Chinese vaccine, yes.
Yes, thank you. Thank you.
Chinese vaccine is very good. It's
That's
about
the one I took.
91%, as they
That's the one I
say.
took.
For Pfizer, they say it is 93% good. For Sputnik, something like 92, and for Sinopharm, Sputnik is Russian vaccine. It is something like 92%, and for Sinopharm, Chinese vaccine, they say it is something like 91 or 92% good as well.
And Professor
so
Snow White, I really appreciate you mentioning this, because depending where you are in the world, you don't hear about some of the vaccines that may be from countries that are not on friendly terms with another country. This needs to not be it needs not to be a political issue. We need to look at the facts, and no matter where it comes from, what it is, we have to discuss this in a neutral way. And thank you for contributing to this.
Yes, Jürgen, I think that you're very right. We don't have to put politics in our health, and I think that we have to see these vaccines if they are good or if they are not good. For example, Prime Minister of Slovak Republic came 2 days ago to Serbia to discuss with our Prime Minister what is the best way for vaccination, and they decided, I'm not sure, they decided to have Sputnik V or 5 or Sinopharm. I'm not sure, I can't say really, but I think they choose between these two vaccines, Russians or Chinese. So politics out of this. And also I would like to tell you that our people are wearing masks everywhere when they are going somewhere inside. And I think 80% of the people are wearing masks outside when there are a lot of people around them. Of course, in the parks, and when there are not a lot of people are not wearing masks. And mostly these are medical masks. This, how can I say, a simple one for surgical masks, because they are very, very cheap. And they are good.
Professor Snow White, what I'm going to tell you, I have not independently verified, but I have been in contact with the Medical Association of Peru, and they speak highly of the Russian vaccine, but do not speak highly of the Chinese vaccine. Now, again, I have not independently verified that. I'm giving you only the opinion of one national medical area. What makes me interested about that is Peru is not involved politically with so they're just purely speaking from a medical perspective, that the Russian vaccine is far superior to the Chinese vaccine.
Mhm. Yes, we have to read a lot about all vaccines because in the different areas they are speaking differently. I think that I read somewhere, I'm not sure now, about AstraZeneca in South Africa, I think.
Yes,
I
yes,
don't know. I
yes.
think that I read about it. So we have to be very, how can I say, we have to read about it and to put away politics just to see which vaccine is good for the people and for our health, of course.
The other thing
I
I
don't-
want to point out to people is even the question of masks is more complicated than simply a question of health. I think Wolfgang pointed out there's also the question of cost, and a poor family cannot afford 3 or 4 euros per child on a regular basis. So governments are going, if we're going to go with a more expensive mask, it is essential that governments provide ways that especially people who are economically challenged are able to afford those masks. Because if not, it will not happen. It's just beyond the capability. That's especially true in places like Africa, where there are many, many poor people, and those people may not have the economic capability of buying expensive masks that have to be changed. So that's something that also has to be thought through. It's not just one variant. There's multiple parts in public health, and therefore there's one solution does not fit all problems. There'll be, each place is going to have to come up with multiple solutions, and undercutting the costs of those masks or teaching people when to use them, when to let them air out or to throw them out, and how to change them. So in that sense, the cloth mask, which may be the least valuable from a purely medical perspective, may be more functional if people will at least use it, versus 40% is better than 0. So these are very hard political things that have to be thought through, and how we're able to get as much protection for as many people as going. I think Wolfgang pointed out that the cost was fairly expensive for the best type of the masks. Am I correct?
Yeah, and Peter, you are correct. In Germany, and I know this from my friend Gunther, we had on an interview, who runs a pharmacy in Cologne in Germany. The government is providing 6 masks of the good ones
Yes.
to their citizens in Germany. And of course, Germany has a lot more money than some other countries. I understand this. And Berecht, see, that's what he's showing us.
What is he showing? What is that saying in German?
It's an authorization for him to get 6 free masks from the good ones. Okay, so he has one, and he doesn't look like he's a real poor person, but of course the government has resources. Now, Peter, I completely agree with you. It's better to wear some mask than no mask at all. But what I disagree and what I'm very disturbed of, and this is now maybe more like a problem here in the United States, is that the government is not telling the full truth. People should be told the truth. You shouldn't say from the CDC on official papers, and still, I just checked it, on their website, that you don't really need to have N95 masks, cloth masks, and better 2 cloth masks are okay. This is a blank lie. It's misleading the people. At least in the United States, we proud ourselves to be a government by the people, for the people. This is not for the people. It's telling a lie. Affording the mask is a different subject. And I agree with you. And if people cannot afford it, and I see people eating from garbage cans across the street where I live, and I live in a very high wealthy area, they may not be able to afford masks that cost $3 or $4, but still we should tell the truth. But anyways, I think we can discuss this, and we're getting more into a political issue. And I wanted to open it up just for a few questioning, but before I do this, maybe give it back to Cuthbert, because he's our, actually this is all about Cuthbert. So I wanted to just get back to him and see if he has any additional comments, or should we open it up for questions? Cuthbert, go ahead.
No, thank you so much, colleagues. I think the old saying goes still right that prevention is better than cure. And also, in order for us to contribute towards the rebound of our activities, economic activities, we need to play our part. Yes, let us wear masks. Yes, let us keep social distances. But we have scenarios where if you walk in a mall, malls have become super spreaders areas for the COVID-19. At the end of the day, most of, especially in Africa, churches have been banned. But when you walk in the mall, there is no social distance, and you have more than 1,000 people moving up and down. I think the onus is up to all of us as individuals. Let us play our role. And also, when it comes to vaccine, we don't have 100% guarantee that it will definitely turn around the tables. So we need to be, precautious. We need to play our leading role. So that is my plea. Let's work together.
Thank you very much, Cuthbert. And I don't see any hands up, but I'd like to give the floor to anyone who wanted to ask Cuthbert a question or has a comment. So please just raise your hand. There's a blue button, I believe, on the right side. You can do this. Or if you don't find this button, just unmute yourself and ask your questions if there's anything.
What's the difference between the N95 and the FFP3? Which one's better? Difference.
Maybe I can respond to this. The N95 and the FFP2 mask apparently are very similar to what it's a geographical thing. N95 is a US approved mask. It's produced in the United States. FFP2 and FFP3 is produced in Europe. So it's a European version of the same, basically. And then there's a KN95, what is the same version made in China. And I believe I heard also there's an N94, same type of mask, what is produced in South Korea. I think Talib had, go ahead.
I have just one question for the group that is more involved with the UN. And I'm wondering, this is a global pandemic. Where is the UN role to really be more supportive of distribution for all countries to be more equal? We know that it's not going to be really one-on-one for each country, but there should be UN. I think with that is what I'm missing in this. In every war, in every political issue, UN is more present. Yeah, I don't see that here right now for the distribution. Being more equal and addressing the countries that maybe, and we know they are there, and a lot of them, they cannot afford it. I would like to hear more about that.
Yeah, and since Talib raised his hand, maybe we give it to Talib because he is a former UNWTO man. Go ahead, Talib.
Thank you. Thank you. I think that's the core of the question here. What is the multilateral system doing? What's the multi-governmental system doing? Nothing at all. This COVID-19 has uncovered the weaknesses of so many of the systems, even the EU, even the United States. There are people that are calling it the divided states now, not the United States. So each state is doing it on its own. And the UN altogether is not, we don't hear any voice, neither from UNWTO nor from WHO. WHO, you have to trace them to try to nail them down to do something or say something. Unfortunately, our discussion here has been a very good discussion, I know. But we're speaking as if we're the experts. We're not the experts here. The experts have not spoken about anything yet. What we can do is the following. Just follow what Casper was saying. We need to urge governments to work together, because without working together, it's not going to be solved, not at all. With vaccine or without a vaccine, if we don't work together to put the measures unified in order, it will never work. Even at the EU, which is supposed to have been working together, they're too late coming into the game now. Each country is having a different regime now. For example, the UK, you have to quarantine, but you go to Spain, go to France, you don't need to quarantine. How can you travel from one place to another if you don't unify systems. That's what I'm trying to say here. I think the international system has to be rebuilt from bottom up, brick by brick. We are not seeing any of the international system operating or working at all. You're absolutely correct. Not just the UN, the EU, the Arab League, any of these organizations is not really working well at all. Not the UN, definitely not. Thank you so much.
And thank you, Talib. And I think that's why it's important also, we as a very insignificant organization in the global travel and tourism world, that we become a little bit louder. Let's get our voice out. And as you rightfully say, we're not the experts, but we're not stupid either. You know, so I think everyone these days could become an expert and could motivate experts that can actually make a difference. And thank you, Gisela.
What matters really, Jürgen, is not what each country is doing on its own. We've heard a good story from Serbia, a bad story from Montenegro. They're neighbors, but that doesn't mean that one is right and one is wrong. Both are not going to produce any results unless they work together. That's the point. We need to raise our voice and say countries must work together, regions must work together, Africa must work together, Europe must work together, Middle East must work together. That's what we should do. That's what our job is. Thank you so much.
Thank you very much. And I don't see any more questions. This is your last chance to raise your hand or say anything. We're way over time, and I see Cuthbert must be exhausted. And I really wanted to thank two people specifically. One is Zine for speaking out. She really spoke from her heart, and this really counts. And I think, Zine, you made a big difference in what you were saying. And of course, so did Cuthbert.
Zine is a wonderful lady. Yes. She's a wonderful lady.
And thank you for this. And Cuthbert, of course, for stepping forward. This is the first time all of us are talking to Cuthbert after he was diagnosed with the virus. And I appreciate, Cuthbert, you came up in such an open forum, and for your pleas, that means so much more now. You know, you've been going through this situation and are going through this situation. And I think most important is you take care of yourself. You get well 100%. So you can be back 150% with the African Tourism Board and of course with World Tourism Network and all the other initiatives you're involved in. And I wanted to give the two last words to Cuthbert, and then Peter can maybe close the session. Before we do this, I wanted to remind everyone, this is live on eTurbo News right now. So you may see us right at this moment. This is live on the ETN social media live stream and our many different platforms. And we'll be repeating this session starting in about 2 hours from now. And you will see it for the next 24 hours well into the weekend. So it'll become an important session. And when you see it on eTurbo News and it says live, this is the live session. And of course, this you don't know, but I'll give you the time. It's 9:37 a.m. here in Hawaii on Friday. And this is live. And when you see it again, it's not live, but you can still ask questions. Just go to wtn.travel and click on contact, and we'll be able to include your questions and maybe to respond to your question. And more important, you should join either the African Tourism Board or the World Tourism Network, or better both. African Tourism Board, you go to africantourismboard.com. Very important if you're located in Africa. Actually, I want you to join the African Tourism Board. If you're located outside Africa, or the extended family for ATB is World Tourism Network. And you join us at wtn.travel, click on register. Also, the event will be archived on livestream.travel. So if you remember this and later on you wanted to watch it, go to livestream.travel. And it'll be also on both the WTN and the African Tourism Board website. And I wanted to thank everyone for listening in, watching in. This was a very important discussion. And again, thank you so much. And I give the microphone to Cuthbert, and then Peter can close it. Good night. Good morning, better, from Hawaii, and good night to many of you in Africa. Go ahead, Cuthbert.
Thank you so much, Jürgen. We really appreciate. I've been following up. You doing a very good job together focus with a positive attitude, with a positive on our way. I have always said, let us focus on the horizon. Let us focus on the rainbow that is shining, waiting to put a smile to each and every one of us. We will beat this virus, that much I am 100%. And also, not all that is best comes from out of the continent. We've got quite a lot of good innovations that are coming out of Africa. Let us embrace, let us appreciate one another as a global community. I am so glad that the medication actually I have been taking, it's been even exported to the United States and to Europe as well. So we are working on it, and I will be engaging with the leadership of African Tourism Board so that we start the research on the actual medication and see if we could assist and save lives. Colleagues, let us focus on the positive. Let us look beyond the storm that is in front of us. And thank you so much for your prayers, and thank you so much for your positive energies and your goodwill messages that we have been receiving as a family. Next week, let's go back to business. We have wasted so much time. So I think I'm ready to get things rolling. Thank you so much, colleagues. I really appreciate, and please stay safe and keep well, and God bless each and every one of us.
Thank you, Cuthbert. Peter.
Yes, I was thinking that it's February 2021, and about this time a year ago, we were facing for the first time the reality that COVID was going to be a worldwide phenomenon. In those days, we were really panicked. There's still much work to be done, but we've come a long way in a year's time. A year ago, no one would have believed that anyone a vaccine in under 4 years. Now it's no longer a question of does a vaccine exist? There's numerous vaccines that exist, and it's only a question of getting those shots in arms. That's a whole different ballgame. We had no understanding a year ago about the concept of masks. Now it's a question of not should we wear a mask or not, but which is a better mask to wear. If you look back to where we were a year ago, we were using the exact same techniques that were practiced in Europe in the 16th century during the Dark Ages and during the Black Plague. And we hadn't advanced. Public health had accomplished almost nothing in 400 years. In 1 year, we've taken giant leaps. That doesn't mean everything is perfect. It doesn't mean we don't have challenges. It doesn't mean that we're not suffering. Zine certainly knows that. Cuthbert knows that. I know it. Most of us know someone who has suffered. But we are now beginning to see light at the end of the tunnel. And I was thinking, the first prayer to be said in the Bible was when Moses prayed for his sister Miriam, who was inflicted with a disease they didn't know what it was. And those words were, Elna Rafanallah, dear God, please heal her. Well, I think our prayer needs to be, Elna Rafanalanu, dear God, heal all of us. Help us to recover from those we've lost. Help us to be able to go forward for those who are sick. Help us to be able to rebuild an industry so that together we can come out healed and stronger, perhaps, than we ever were. And if we can accomplish that, then truly this will have been a year of miracles. Thank you.
Thank you, guys.
Bye-bye.